Morning, talking today about breast implant massage following either cosmetic breast augment or reconstruction following mastectomy. I'm Dr. Dumestre, board certified plastic surgeon. So when you are getting a implant placed, I'm going to start with the cosmetic scenario for a breast augment. Initially, your implants sit really high and tight, and that's because we're basically creating a space to fit this object in one where there's nothing. So naturally you've got more stretch, more room in the upper portion. So the implant tends to sit a bit high, and then you have your breast sitting a little bit low. And then with time, everything stretches. If they're under the muscle stretches, you're moving, everything is relaxing, and that implant falls into position. So the question is, should you be doing implant massage and how? So again, everyone is super different on this as far as surgeons go. Everyone has their own preferences. For me, implant massage is on a case-by-case basis. So because implants are heavy, I know they're naturally going to drop. I want to slow that progression as much as possible so that at a year, they're not way down here. They're still sitting pretty perky, and then you can get results that last for those 15 plus years. So personally, I don't use it, but there's different techniques. Like sometimes if they're fully under the muscle, your surgeon will get you doing specific exercises. My personal approach is I wait till the 6 week or 3 month mark. If one is falling slightly more faster than the other, then I may get you to do that. Or if I notice any capsular contracture. So capsular contracture, when you stick an implant in your body naturally responds by sealing it off from the rest of you with a very thin layer of scar tissue known as the capsule. Now this scar tissue, when it's healthy, is really thin, really translucent, and very soft. With capsular contracture, you basically get a thickening of that scar tissue, and with that, you can actually notice a change in the feel of the implant, and it can change in position. So if that's the case, and then this is the same for my reconstruction patients, so if you've had implant reconstruction after mastectomy, especially with radiation, I have you do implant massage lifelong. So the way I recommend doing implant massage is you basically envision that you've got this scar all around the implant, and you want to put pressure on all of it to loosen it. So scars respond to pressure with softening. So when we're doing incision scar massage, deep pressure, rolling circular motion along that to soften them. With the implant, because we don't want to avoid pushing the implant down or out, the way I like to do it is to support the base of the implant and then basically do deep squeezes where you're getting every surface of that implant, every aspect of that scar tissue. This shouldn't be painful. Mild discomfort is okay. You are not going to ruin the implant. These things can be manipulated, squeezed, stomped on. It would take like car accident type force or wear and tear over many years to create a hole. So you're just working that, I just say twice a day, work maybe 10 times all the way around the implant to continue to apply pressure to that scar that's all the way around there without pushing your implant down or out to the side.